Hi, my name is Isaiko and I am a birth doula. This is my friend Olena.
Hello.
And we are going to practice birth breathing today. So I want to show you some techniques which might be really helpful during labor. They're pretty simple and easy as long as you try them before labor. So let's get started. The first breathing technique I want to show you is called distressed breathing. So it's quite simple again. What you want to do is breathe in with your nose and breathe out with your mouth. So we are going to put our hands on belly. Yeah, just like that, just to control the breathing. And it will help if you count, or maybe your birth doula can count for you at labor. So you do breathing in with your nose and count to 4. And slowly breathe out with your mouth and count to 6. Okay, let's try. Now I'm going to count for Lena, okay? Okay, let's get started. 1, 2, 3, 4. And slowly with your mouth. 1, 2, 3, 4, 5, 6. If you can't hold your breath for 4 or 6 seconds, you can do a little less. So let's say 3 and 4. Let's try. So breathe in with your nose. 1, 2, 3. And breathe out. 1, 2, 3, 4. Perfect. How does it feel?
Perfect.
This technique we just demonstrated with Elena is really helpful during active labor. Now the next stage of labor is transition. It can be really hard, so breathing is helpful. I'm going to share with you another technique for breathing during transition in labor. It is called transition breathing. Would recommend you to wait before pushing, but you still feel the urge to push and bear down. Just try to use this breathing technique and it should help you to prevent from pushing a little bit too early than you need to. Okay, so what are we supposed to do during this breathing? During your transition breathing, what you want to do is take 2 shallow breaths in and 2 shallow breaths out. So let's try. Would you like to try that?
Yeah, sure.
Okay, let's try together. Okay, it's working for her. What you want to do is to prevent your breathing, to prevent hyperventilation. So just to try to take those shallow, nice breaths. Okay, let's try it again. It works fantastic.
Yeah.
Okay, now it's time to push the baby out. This is a perfect moment and I really want to help you, especially if it's your first labor, to explain how to do it best so that you have easy transition into being a parent. Okay, so the most important tip that I would recommend to do if you have your doula with you or if you have your partner at labor, please remember or let them remind you that you have to keep your eyes open. So that's really important. Even though you might think it's something little and you may forget, still try to remember to keep your eyes open and concentrate on pushing your baby out. This will help you to visualize the baby coming out to you. Okay, what about the breathing? So the breathing is the following. What you really want to do is breathe in with your nose and slowly get that energy together and kind of imagine that you're pushing your baby out. So together with your breath, try to visualize again that the baby is coming out and that you're breathing this baby out. So you get all the energy, you breathe in with your nose, you squeeze your uterus and you try to push the baby out together with breathing. Okay, let's try together. For Elena, you might want to keep your hands here if someone is holding your legs during pushing, or they may want you to hold your legs like this, depending on the position you are at. But still, it will help to concentrate on breathing. So try to breathe in with your nose. It's okay to make little sounds, or even if you want to make real loud growing noise, it's okay. It will help you, it will help the baby. So just concentrate on breathing with your nose and imagine that you're pushing the baby out. So here you must visualize the pressure, like your uterus is contracting and you're pushing the baby. And same time when you're doing this press, please look and imagine that your baby is coming. This will help you a lot. And I hope you have a wonderful birth. See you!
See you.